All right, good morning. Just let me know if you can hear me. All right, good. So just give me 1 second here. I had a few technical difficulties here trying to get started, but there, I think the slide, and I have a dog, my dog's in the room with me right now and he wants to get out. So just 1 second. All right, there we go. Hopefully he won't come back to scratch on the door. So I got the slide up there. I'll put the first, well, I'll put them all up here, the poll questions. So if you just quickly answer that question, I'll put the other two up as well for the end. And then as always, if you're interested, here is the participant workbook and your local contact information for the Bud Out program. And I think this might be all for today, just the three of us. So today I'm just going to talk just a little bit of review. And this is sort of an opportunity when we normally run the program. If people have any questions concerning your quit attempt or anything about the Bud Out program and continuing on. So feel free anytime you have any questions in the chat, just ask away. And so like I said, we'll focus a little bit on medications today, but again, this is sort of just a general overview of the program, and nothing I'm going to go back and talk about things we talked about in previous weeks, but the medication talk will sort of focus on some of those things we talked about in previous weeks. So as always, before every presentation, there are a little disclaimer that this is the property of the DND, so any retransmission of the slides or the presentation is strictly prohibited. Not that this topic has sensitive information, but for those that do, and if you have any children, just use parental discretion. If you have any stories, anything to tell, again, will not be discussed outside of this webinar. The webinar is being recorded and will be available for viewing. I don't think, I was in a meeting earlier this week. There is a CFMWS YouTube channel that they have. I don't know if they've advertised that extensively, but all the webinars for health promotion are on the YouTube channel. Unfortunately, you can't view it if you're on the D1 or on that system. So it really can only be viewed during off hours when you're not on the D1 or any of the other military systems. But they will be available if you are interested in going back. So that's our little disclaimer. Just double check here. So I made everything available, the resources, the polls, so we are good to go. So just as an overview, and we've talked about this throughout this series of webinars, and we talked about how nicotine is a stimulant, and because it is a stimulant, it does have addictive properties, and so it is that stimulant effect, that chemical in cigarettes, nicotine, that is responsible for that addictive property. And over time, you build up a tolerance, so you need more and more nicotine in order to get the same effect. So that's why it is very highly addictive. As with any drug, you need more and more over time because you build up your tolerance in order to achieve the same effect. What is interesting about nicotine is the high propensity for withdrawal symptoms. And I'm sure anybody who has has smoked in the past is very familiar with some of these symptoms and what it can produce. It is that cycle of dependence that sort of fuels that urge for you to smoke. So, and sometimes there's environmental triggers, and we talked about different situations over the last few weeks in which you may be more likely to smoke or get the urge to smoke, associated with food, or as it says there in the list there, even drinking coffee or alcohol, even just the handling of the cigarette, if having that in your hands, the oral sensation. Some people might roll cigarettes or roll tobacco. So even the act of doing that can be associated with a trigger of increasing the urge to smoke, or just smelling cigarette smoke is something that can cause those symptoms to intensify, the withdrawal symptoms to intensify over time. There is, in terms of the withdrawal symptoms appearing, they're strongest, obviously, the very first few days after quitting, but they do subside over time. However, there is the risk of relapse because you do become hardwired, again, those chemical changes in your brain as a result of having nicotine, that when those triggers are in place, it does increase your chances, if you've been a smoker, obviously, to have a relapse. And as we talked about, I believe last week, it is perfectly okay. That's very common to have a relapse. It's not a failure on oneself because of all the triggers that are present. But just to review just some of those withdrawal symptoms, the most common ones being increased appetite and, of course, the urge to smoke. So that's something that's very persistent in the majority of people. There are some sort of like mental health symptoms that can occur, like depression, restlessness, poor concentration. Those are sort of the next, irritability and aggression or other symptoms. And we've talked about those in previous weeks as well. And it's a different timeline in terms of the prevalence, the duration of the symptoms that last. But all of these will usually go away over time. And there's the duration over which you would expect to see those types of symptoms. So that's just a little bit of an overview to help to just sort of explain where I'm going today with talking about medications. Are there any questions though so far? All right. Oh, Sharon can't hear me right now. Lisa, can you still hear me? Okay. I'm not sure, Sharon. Maybe just check sometimes readjusting the mic or the source of your mic on your laptop or computer might change that, or maybe just try logging out and logging back in. I'm not sure what else to suggest. All right, so why use medications? I did talk about in previous weeks about the water wings theory that, you shouldn't just rely on just quitting cold turkey or, behavioral type of therapy on its own, that you sort of need a fallback or a safety net. So medications can be that safety net. They can help you to manage the withdrawal symptoms. So all those withdrawal symptoms from the previous slide, they can be minimized by using medications. Now, if those withdrawal symptoms aren't severe for you, or they're not as prevalent, then perhaps you don't need medication. But again, it is an option. It doesn't address all of the addiction-related behaviors, but it can help to reduce those withdrawal symptoms. It does increase your success rate of quitting if you do use some type of medication, because as it shows here on this slide, there's only a 5 to 10% success rate for people who quit cold turkey. Those who just use medications, it's around 20%. But if you combine medications with some type of behavioral intervention, and that can be, a number of things. Behavioral intervention could be maybe, you're going to health services at your winger base and you're talking either to the doctor, or if there's a counselor or a social worker there, and sort of working through some of those behavioral issues. It could be through the Butt Out program of coming to see someone like myself, either one-on-one, or sometimes if we have enough people, we do group sessions and just, sort of talk about some of the things that you're going through in your quit attempt. So if you combine that behavioral type of intervention with medication, there's a higher success rate. Now, some people need a little bit more intense behavioral medication, and there's lots of things out there that can be done. There's like hypnosis and that some people have tried that works for them. So using that type of behavioral intervention or others in combination with medication will produce the highest success rate for your quit attempt. And this, oops, let me just 1 minute here. that just froze on me. Sorry about that. There we go. Okay, so now I can see that. I couldn't see the screen. Did it advance the slide advance on your end? It didn't advance on mine, but now it did. But I think we're good. Acupuncture. That is a good one. I think my thoughts on that would be is that with acupuncture, what it's doing, similar to a medication, when acupuncture is supposed to release those pleasure endorphins in your brain, like the dopamines and those types of neurochemicals, which is the same thing that some of the prescription medications do. So I think because it's activating the same pleasure chemicals in the brain, I've heard that some people do definitely have success with acupuncture. So it's again, you could view it as sort of a non-medicinal type of intervention that would be similar to, if not exactly the same as taking a medication, because there are, and we'll see here in a few minutes, some negative side effects to some of the medications that I'm going to talk about. And particularly if you have certain conditions, if you're prone to seizures or depression, some of these medications would not be recommended. So something like acupuncture, which, like I said, can produce similar effects in the brain chemistry, might be the way to go. So as this slide says here, not every medication necessarily will help you to quit. It is linked to physical dependence, and even though we do recommend, again, using some type of safety net like a medication, their effectiveness will vary from person to person, depending on any pre-existing conditions that you have and so forth. Now, I don't know if you agree with the second point or not, but a lot of stats show that many of the current tobacco users in the military are not strongly dependent on nicotine. I was trying to look for those statistics, that study that they did. I couldn't find it, but this is what we're being told, that it isn't necessarily that there's a strong addiction to nicotine amongst military members, but it still is a concern. What we ask people to do in some of our sessions is to go through the Fagerstrom test. And this gives you some idea to assess your nicotine dependence. And it might then, because we only suggest the medications for people who are highly dependent on nicotine. And by going through the Fagerstrom test, this will give you some indication of whether or not nicotine may be a way to go. So here is basically the questions that the Fagerstrom test asks you. On my other screen here, I just have to bring up the actual Fagerstrom test, because this one just has the questions. The one I'm looking at that you can't see, what it shows is that for the first question, it asks, how soon after you wake up do you smoke your first cigarette? And what it has here, it has 4 different things: within 5 minutes, 6 to 30 minutes, 31 to 60, and then after 60. And of course, if it's within 5 minutes, you give yourself, on this rating scale, it has a score of 3, 6 to 30 minutes, a score of 2, 31 to 60, a score of 1, and then after 60, a score of 0. So you would rate yourself on how soon after you wake up you have a cigarette. The shorter time, then the higher the score. The next question is sort of a yes or no. So you give yourself a point for 1 point for yes, no points for no. If you find it difficult to refrain from smoking in certain places where it is forbidden. And they give, it's not on your screen, but it gives examples of a church or a library, places like that. So if you're at church or you're in the library and you get an urge to smoke, you would check off yes and give yourself a score of 1. The next question is, what cigarette would you hate to give up? So the one where you get a point is the first thing in the morning. If you would hate to give up that cigarette first thing in the morning, you give yourself a score of 1. Any other time of day, it's a score of 0. How many cigarettes do you smoke per day? 10 or less, you give yourself a score of 0. 11 to 20, a score of 1. 21 to 30, a score of 2. And 31 or more per day is a score of 3. Do you smoke more frequently in the morning? For that one, you give yourself a score of 1 for yes, 0 for no. And the final question, do you smoke even if you are sick in bed most of the day? You give yourself a score of 1 for yes and 0 for no. Then you add up those scores. And what it shows then is that a score of 1 to 2 is low dependence, so you probably wouldn't need medications. If you give yourself a score of 3 to 4, then it's low to moderate dependence. You may then want to start to think about medications. 5 to 7 score is a moderate dependence, and then probably it would be suggested by your doctor or your pharmacist to take some type of medication. If your score is eight or more, then that's a high dependence, and they would recommend medication. So that just gives you a bit of an idea. And most, well, at least that I know anyway, pharmacists or physicians would sort of give you this test if you are considering any type of medication. So what medications are out there? The first category is the nicotine replacement therapies, or NRTs. And those come in many different forms, as you show there. There's a lot of different brand names, but the forms are the mouth spray, inhaler, lozenges, gum, and the patch. Those ones are readily available at your pharmacist. They do not require, or usually, although sometimes it does differ from province to province, but usually does not require prescription. You may have to ask the pharmacist for them. I can't remember now if they are available in the aisles or if you have to go to the pharmacist, but if you don't see them in the aisles, then just go ask your pharmacist and they can bring them to you. The ones that do require the prescription is the Zyban and the Champex, and that just also has their actual medical names there: bupropion or I can't say that one, Vernicillin. Well, let's just call them Zyban and Champex. That's much easier. So I'm going to just talk a little bit about all of these. The first part is, which nicotine replacement what is nicotine replacement therapy? So all the gums, the lozenges, those sorts of things. So the nicotine replacement therapies, they have pure nicotine and they don't have any of the chemicals that you find in a cigarette. What they do is they help to maintain a certain level of nicotine in your blood, so to minimize those cravings and withdrawal symptoms. So it would depend, there's different strengths of them that you can use. It would depend on how addicted you are or what your dependence is on nicotine, determining which one you would take. They are less addictive than cigarettes because there's a delayed time for the nicotine to reach your brain, depending on how you take it. If it's a patch through the skin, those are more longer lasting. And it takes a bit longer for it to get into your system because it has to go through your skin, as opposed, for example, like a nasal spray, because it's going directly into your blood system, because the mucosal membranes in your nose are very thin, and so it goes directly into your bloodstream if you're using something like an inhaler. So those are more fast acting. And this sort of, I got ahead of myself here. So the long-acting ones are the patch, slow because it's going through the skin. They are preferred for more dependent tobacco users because they are slow-acting and they sort of have an effect over a longer period of time. The more shorter-acting ones, the gums, the inhalers, the sprays, lozenges, they have a shorter effect, but they do have that effect much more quickly than something like the patch. It's more preferred for the more sporadic or casual smokers. And with all of these, they can be used alone, particularly the short-acting ones, or in combination with a more longer-acting NRT and other medications, the prescription ones. So you could actually be on the patch and the gum at the same time, or something like the gum and a prescription medication at the same time. Has anyone ever used any of these products or had any success with them, or maybe not had success with them? Yeah. So it is something, again, maybe you haven't considered them because it's just not something, using a medication. Some people don't like using medications, or maybe they like to use more natural methods. like you said, Lisa, acupuncture or something like that, and that's perfectly fine as well. So this here just gives you a bit more understanding of the nicotine replacement therapies. My dog is scratching and chewing up the rug under the desk here. Sorry about this. He's usually pretty good every week, but today he's a little rambunctious. So the nicotine replacement therapy products, the patch, so obviously you place those usually on your upper arm or hip, but you should select a different site each day because it can cause skin irritations. If you use the same spot, and then you'll get redness, or it might start, your skin will start to get really raw if you put it in the same spot all the time. It can cause headaches, and particularly wearing them at night. Some people, side effects have shown insomnia and even nightmares if you leave the patch on at night. So those are the long-acting ones. The gum, lots of different products that are out there. Thrive, Nicorette, you've probably heard of those. For those, you want to use them like one every 1 to 2 hours, maximum of 20 pieces a day. And of course, you reduce the use over time. And it's not like chewing a regular piece of gum, as you'll see on the next slide. It's more using the chew and park technique. What can happen with these in terms of side effects is, your jaw will become sore because think about chewing. Well, again, it's chew and park, but chewing a piece of gum, 20 pieces a day, your jaw is probably going to get sore, or even your mouth or throat as well can show some soreness. So for the gum, this is sort of the general technique that's suggested. So again, it's not like perhaps chewing a normal piece of gum, because what needs to happen is the park. So parking it sort of in between your teeth and the side of your mouth, in the gum line here, so that the actual nicotine that's in the product can be absorbed into your system. So that's really important. I know some people, they'll get the gum, they'll chew it like a regular piece of gum, and they say, oh, it's not working. Well, it's probably because they're not parking it in that area so that it's getting into the gum, and you want it to go there because that's the easiest place, because the skin is thinner in your gums, and that's where it needs to be in order for the nicotine to get into your system. And you just keep repeating this over time as you're chewing that piece of gum. So if you follow that technique, it should show some positive effects in terms of curbing your dependence on nicotine. Does it cause irritation as well? I haven't heard, nothing that I've read. Do you mean like irritation, like in your gums, redness, things like that? If that's what you mean, I haven't heard anything like that. Most thing is just that you're, getting sore in terms, or like with the patch. Not as much. It'd be just more tiredness and soreness from chewing the gum, particularly if you're not used to chewing gum. It can definitely cause some soreness in that regard with your jaw, with your mouth, and possibly with your throat. Most of the times, the soreness in the throat is because people aren't letting the nicotine from the gum, obviously mixing with your saliva, they aren't letting it absorb through your gums, and they're swallowing the juice that's produced, and that's what causes some of that irritation then in your throat. But it wouldn't be similar to the patch in terms of causing that really redness and sometimes itchiness and soreness in your skin. For the other products, the other NRT products, the lozenges, this is something that, again, similar to the gum, one every 1 to 2 hours, maximum of 20 pieces per day. This one can cause a bit more soreness in your jaw, mouth, and throat. But so it's somewhat similar to gum. You don't use the parking technique for that, but it's a little bit different in that way. The inhaler, it should be, when you use it, a very short and shallow puff, similar to what you do with a cigarette. It's about around 5 to 10 minutes at a time when you're doing that. So it could cause some burning side effects, warm or cool sensation, which can be bothering, and again, some throat and mouth irritation. And then there's a mouth spray. So you would use about 1 or 2 sprays every 30 to 60 minutes, max of 2 sprays per episode, and about 4 sprays per hour. It seems like a lot, 64 sprays per day, but you could use that. And again, this is going to cause some mouth and throat irritation, other symptoms, hiccups, nausea, indigestion, increased saliva production, and a dry mouth. I guess that would be opposite. So I guess maybe for some people, because you can't have increased saliva and a dry mouth at the same time. So I guess for some people, it causes increased saliva production. Other people get a dry mouth. So that just gives a little rundown of all the different NRT products. Are there any questions about that? About NRTs? All right. So which NRT should you use? No one NRT is more effective than the other. It's really based on your preference. Whatever, if you don't like to chew gum, then probably you wouldn't use the gum, or maybe you don't necessarily want to have something that's going to be in your mouth for a long period of time. So then the inhaler or the mouth spray might be better for you. What you might want to consider as well is just some of the practical benefits. Gum and lozenges are very easier to use. The inhaler, it does address some of those sensory aspects of smoking. And with the mouth spray, some people who can't use gum because, if you have crowns in your mouth or any other type of dental work, that the gum can stick to that. So they might prefer the mouth spray instead. So again, it's all comes down to personal preference. No one NRT is better than the other. So that's NRTs. There's 2 main prescription medications that you would need to go either to your doctor or to your pharmacist to get a prescription. The first is Zyban. So Zyban actually, it was never developed as a medication for smoking cessation. It is an antidepressant, but it does seem to, although they're not exactly sure why it helps to curb the urge to smoke in people who are quitting smoking. What they suspect is that because it increases those pleasure chemicals, pleasure centers in your brain, the dopamines, the epinephrines, similar to what nicotine does. Yes, it is an antidepressant. Yeah. So that's what Zyban was developed for, as an antidepressant, but then probably just by, I don't know if by luck or just by pure coincidence, they discover that it also helps people to quit smoking. And like I said, it's probably because the chemicals that are in Zyban are increasing dopamine and epinephrine production, similar to the way nicotine does. So you're getting that relaxation effect similar to what you would when you're smoking a cigarette. But again, it was never ever developed as a smoking cessation therapy. It was developed to help people with depression. So as you see here, Zyban, usually it's prescribed 1 tablet once daily for 3 days, and then you sort of use 1 tablet twice daily for 7 to 12 weeks. Usually we'll ask people to start using Zyban while they still are smoking. But then usually after 7 days of both smoking and using Zyban, that's when you then would stop smoking and just be on the Zyban. So it's sort of just easing people into, oops, I didn't bring up that slide. Here's the slide. It really doesn't matter that you are using the 2, smoking and using the Zyban at the same time, at least for the first week, but you wouldn't want to keep doing that because the idea is to quit smoking. But again, it's just to ease people into using the medication. Side effects, so it can result in severe skin rashes. There can be some mood disturbances such as panic and agitation, as well as that can produce seizures. Other side effects: insomnia, tremors, decreased appetite, indigestion, and a dry mouth. I think, as I said earlier, it's not for individuals who have a history of seizures. So if that is something, then definitely the doctor or physician would not prescribe Zyban. The one that's most commonly used and that is prescribed within the CAF is Champix. And this is a drug that was developed specifically for smoking cessation. Now, it's not necessarily a nicotine replacement therapy. It can be combined with other NRTs. But what this one is it's synthetic nicotine. It's a form of synthetic nicotine. So it actually helps reduce those cravings, and it does help to decrease the pleasurable effects of nicotine. And like Zyban, it does require prescription. So this is the one most commonly prescribed in the CAF. So this one's usually used, days 1 to 3. So it's sort of a gradual amount that's used. So 0.5 milligrams once daily, then days 4 to 7, 0.5 milligrams twice daily. And then we sort of get to, when you get to day 8 to week 12 of your quit, it's 1 milligram twice daily. So gradually increasing the amount until you get to that point. And sometimes they'll sort of adjust it based on your level of tolerance. Some side effects here are nausea, disruption of sleep, dreams, taste disturbance, exacerbation of underlying psychiatric illnesses such as depression and anxiety. So this would be a case here. If you do suffer from depression, they probably would go, instead of Champix, they would suggest Zyban and would have a dual effect. So individuals definitely who have those types of psychiatric illnesses like depression or anxiety would have to be monitored closely and maybe taken off of Champix and move to something like Zyban, or maybe those types of prescription drugs wouldn't be of benefit at all. And that's when you would go back to the nicotine replacement therapy. So that sort of summarizes all the different prescription medications, the NRTs that are out there. They can be used, so combination therapies. There isn't a lot of evidence to show that combining a prescription drug or with an NRT or a long-lasting and short-acting NRT together has any more effectiveness than just using one of these on their own. It would mostly be people who are highly dependent on tobacco, on nicotine, where they would combine a drug like Zyban with a nicotine replacement therapy. So again, it would depend on your level of dependence, but usually using one of these, either one of the Zyban or Champix or one of the NRTs should be enough. But again, it depends on personal preference and your level of dependence. I did talk last week about electronic cigarettes, vaping, and all of that. So I'm not going to go too deeply into that today, but as we learned last week, it's a battery-powered mechanism. It vaporizes the liquid. And so, the amount, it depends on what you're getting. It's different amounts of nicotine, other types of impurities that are part of that. What it can do and why people think it could be a smoking cessation aid is it mimics the look and feel of having a cigarette. The scents, the vapors, the smoke, it's all associated with smoking behaviors. However, the ingredients aren't standardized like they are in an NRT or prescription medication. So depending on where you're getting it, where you're buying it, there's different levels of nicotine that these could contain. And as I talked about last week, there isn't sufficient evidence currently to show that the e-cigarettes, the vaping devices, are effective as a smoking cessation aid. And then the other thing, unlike the drugs, whether it's NRTs or prescription drugs, the electronic cigarettes aren't covered by the CAF Drug Benefit Program. So, it can help, as it says there's some evidence that it can help some tobacco users, particularly if people have tried NRTs, have tried the prescription medications, it didn't work for them. Then almost as, not as a last resort, but as something else to try, that's then when perhaps it would be suggested to use an e-cigarette if other methods haven't worked in the past. Definitely, there's an increased risk of greater toxicity when if you are using a vaping product and cigarettes at the same time. So that's definitely not suggested. And then there's a potential for escalated use of tobacco for those who do not successfully quit with e-cigarettes. So some people will use it as a smoking cessation aid, but then they actually become addicted to the vaping device. And the goal here is to quit smoking, and some people will just replace smoking cigarettes with the e-cigarette because they think it's healthier. As I talked about last week, there is some evidence that it is a bit healthier because you're not necessarily getting the smoke that comes along with smoking a cigarette. It is a vapor, so that's not as bad for your health, but it still contains nicotine. Unless you can, get off of the nicotine altogether, and you're using the vaping machine with other liquids, other flavor liquids that don't contain nicotine, but perhaps you're still wanting that sensation of having something in your hands and the oral sensation of smoking a cigarette. Then as long as it doesn't contain nicotine, then the harms are pretty minimal if you're just using some type of flavored juice as an alternative. So just some of the key messages here. Not everyone needs medication to quit, but it can help. Again, the water wings theory that I talked about in the previous week. There's no one drug that is best for people to quit smoking. But there should be some consideration given to nicotine replacement therapy alone before prescribing Champix or Zyban. So the prescription drugs are sort of, I guess the way you look at it, if you can quit smoking by changing your behavior first and foremost, that's what you would look at first. Maybe use one of the nicotine replacement therapies as your water wings. If the nicotine replacement therapies don't work, then you would go to some of the prescription drugs like Champix or Zyban. And then if none of that works, and I guess I should have said in between there, some of the nicotine replacement therapies could be something like acupuncture or hypnotism. And then if none of that works, then going to Champix and Zyban. And then if all else fails, then perhaps using the e-cigarettes. But again, it could be a combination of just going back and forth, trying different things. As we talked about last week, if you have a relapse, that's not a failure on your part, because it is, it's an addictive substance, and it does require, it could require multiple attempts in order to quit. And the one thing, definitely, if you are considering any of these, when you quit, the dosing schedule, it's sort of negotiable between yourself and your primary care provider as to what's best for you, and they'll talk to you about that. Some other considerations to think about is that all those medications, again, available through your CAF drug plan. There's no quantity limits, there's no cap on lifetime spending, and there's no criteria that need to be met. So it's readily available whether it's your first time quitting or your 20th time trying to quit. There's no limit on that, and you can keep going back and getting that help, and it's all covered through your drug plan. Definitely the counseling, psychological support, it can enhance your quit attempt. And it should really, whether you're using medication or not, it should be something to consider. Like I said, whether it's seeing your doctor, the pharmacist, social worker, whoever's in health services at your wing or base. Or like I said, even some of although we're not counselors or psychologists in health promotion, we can provide some one-on-one support through the Butt Out program, or group support as well through the Butt Out program. Another thing to consider if you are being deployed, we can't guarantee that the smoking cessation medications, both the NRTs and the prescription drugs, they may not be available as consistently. So that's something to keep in mind if you are being deployed, that it may not be as readily available. A few other key messages related to this is that if you are a Class A reservist or Class B reservist and you're employed only on a short-term basis, then generally these smoking cessation medications, the Champix and Zyban are not available to receive those. So if you are a reservist, And again, care for tobacco use, it doesn't necessarily require that medications are provided anyway. But just to, if you are a reservist, just to keep that in mind. And the level of care that's provided to anyone who is quitting smoking, it should be sort of tailored to the individual, whatever you're comfortable with. If you don't want to take medications, that's perfectly okay. Talk to your healthcare provider. They'll be able to provide some assistance, perhaps with some type of behavioral therapy, or support groups, like I said, that we provide through health promotion. But it should be, tailored to what you want, and what you think will help you best. And you can have that conversation with your healthcare provider. So I believe I'm pretty much at the end of this presentation. Are there any questions that you might have? If not, don't forget to fill out the poll for the last two questions at the end there. So just make sure that you fill those out. Download any of the handouts again for future use, as well as if you're not in Moose Jaw where I am and you need to contact somebody at your wing or base, then that handout is there as well, and with their contact information. Now, as we're going through COVID, and I'll just put up, as we do always, the last slide there with COVID resources. The emails that are in that contact resource are for people, because we're all mostly working from home at the moment, but that is changing, but it varies from base to base. But people will still have access to the emails in those lists. So if you are wanting to contact someone to help with your quit smoking attempt at your wing or base, that information is there. But if there are no further questions, this is the last in the series for the smoking cessation webinars. So I hope for those who have joined in that you found these useful and that you can apply them if you are trying to quit smoking. But again, if you have any questions in the future, all our contact information is in that resource for every wing and base across the country. So please feel free to reach out. And with that, I'd like to thank you for tuning in, and wish you the best of luck if you're looking to quit smoking, and we're here to help. So thanks again, and enjoy the rest of your day and enjoy the weekend.